think so. Hi, I'm Elizabeth Baker, and I'm going to do an informative speech on the difference between pre-K and Head Start. When I'm asked what is the difference in Head Start and pre-K, I tell the person that I am talking to that there are similarities and differences. Some of the similarities are that each program teaches the children their basics, ABCs, numbers, colors, and self-help skills. Head Start teaches through play. We ask open-ended questions so that we are not telling the children, to give us a specific answer, so that they can give us the answer. I know that when I say the children learn through play, that sounds odd, but children can learn a lot just by interacting with their peers. And when they are playing, we work on counting and colors by just asking them, what color is that? Or how many do you have? Pre-K teaches more by structure. They are able to set the child down in groups at tables, and the children are told to come over and work on a piece of paper or sit down and write their name, whereas at Head Start it is all done on volunteer. It's up to the child to come over and sit down and work on that, writing their names, writing their numbers, learning. So we try to do all the learning through play, interacting with the kids through games with the Head Start program. Head Start benefits our lower income families, whereas we provide transportation. Pre-K, a lot of those children are took to school. And Head Start is a full-day program where we provide underprivileged children with meals from the ages of 3 to 4 and some 5-year-olds, usually turning 5. We also provide them with dental checkups, or if they need to go see a pediatric dentist, we also provide a way to get to the dentist through the Family Advocates job. Pre-K and Head Start do testing to help a child if there is a disability or delay in the child's development. The program that Head Start uses, we transport the children to the early Head Start where they work on if they have an issue with speech or muscle tone or whatever, they will receive therapies for that. Also, the pre-Ks, they might refer them, but they don't provide a way to get to and from the dentist, whereas Head Start does. And I mean, I work for the Head Start program, so I really feel that Head Start is a benefit for the children, that they can interact with peers. We also help parents out. We do a lot of work with the parents when they have questions or concern about their children. Pre-K and Head Start does, I'm repeating myself. Some of the history on Head Start is in the New York Times on Wednesday, November the 19th, 2000. The Head Start is a federal program that is aimed to promote school readiness for preschool-age children from low-income families. It began in 1965 to provide summer school for children about to start kindergarten and later expanded to include year-round preschool classes. The program also serves younger children through an early Head Start. Overseen in the Department of Health and Human Services, Head Start will spend more than $7.9 billion in 2012 and serves nearly 1 million children nationwide. However, tens of thousands of children could be dropped from the program if Congress cannot find a way to prevent automatic cuts in the federal budget in the year 2013. The federal cuts would follow a decade of decline and supplement financing for the Head Start by state. It also, in the last decade, a number of the states supporting Head Start dropped by only 1 to 16. But state financing fell 45%, a total of $122 billion from 2001 to 2010. According to the National Institute of Early Education Research at Rutgers University. Supporters of Head Start fear the cuts would put more children at a disadvantage even before they reach kindergarten. Critics include congressional Republicans who tried to slash the Head Start budget in 2011. The cuts would help. They say the cuts would help rein in an overpriced program whose benefits have not been proven. Even though in 2010 federal study says Head Start has benefits for both 3-year-olds and 4-year-olds in the cognitive, health, and parental domain, and for 3-year-olds in the social, emotional domain. However, the benefits of access to Head Start at age 4 are largely absent for first grade for the program population as a whole. In 2005, Dr. W. Stephen Barnett, director of the National Institute of Early Education Research, and associate Dr. Jason T. Huston evaluated several early studies of Head Start looking at their methodology and conclusions. They found mixed but generally positive evidence that Head Start got results. While they concluded that the initial IQ gains faded over time, their report said gains are subject matter specific, achievement tests are more likely to be maintained, decreased grades, retention, and special education rates, and increased high school graduation rates were common. The analysis also said Head Start also seems likely to improve the social behavior, reducing crime, and reducing crime in the poverty areas. Children that attend Head Start, even today, I've worked for Head Start for 7 years now, and the children that were in Head Start when I first started they're doing good in school, whereas some of the children went from Head Start and attended pre-K. You know, you learn your basics at Head Start, and then your pre-K does your more structured skills. And in 2007, there was 3% of 5-year-olds were enrolled in Head Start. There was a 51% of 4-year-olds and a 36% of 3-year-olds. Head Start and pre-K are very important programs to the early children. And today I've just talked about some advantages and disadvantages of the pre-K and Head Start. Thank you.